welcome back to another edition of the Prepper Recon podcast. Our mission is to bring you great interviews with preppers from around the world so you can be better informed and better prepared for everything from a hurricane to the end of the world as we know it. This episode is brought to you by CampingSurvival.com. Whether your plan is to bug out or bug in, CampingSurvival.com has all of your preparedness needs, including bug-out bags, long-term storage food, water filters, gas masks, and first aid kits. Check them out online today at CampingSurvival.com. Be sure to enter coupon code PrepperRecon for a 5% discount on your entire order. Today's guests are Dr. Bones and Nurse Amy. Dr. Bones and Nurse Amy are the hosts of the Doom and Bloom podcast, where they teach folks to be prepared through survival medicine. Joe, Amy, thanks so much for making time to come on the show today.
You are very welcome. We are happy to be here.
It's an honor.
Absolutely, and we met at the Life Changes Be Ready Expo earlier this month, and that was a really, really good time. It was really nice meeting you guys in person.
Absolutely, it was fun, and there were a lot of people there, and it just goes to show that there is a great opportunity for us to start preaching preparedness to the good people of Florida.
Florida, yeah. Everyone's been writing Florida off for years. Oh, you live in Florida, forget it. You better get out of there.
Yeah.
But honestly, there's a lot of positive reasons why people should be living in Florida.
Yeah, and we don't have to worry about cutting wood in the winter.
True that.
We're looking for water or growing food basically all year round.
Yeah. And Dr. Bones, tell us a little bit about your weekly podcast and what inspired you to start it.
Well, our podcast is now called the Survival Medicine Hour with Dr. Bones and Nurse Amy. And we have always been, living in South Florida, we've always been hurricane preparedness folks. So instead of having the 3 days worth of food that everybody has, we've always had a couple of weeks worth of food and water, and the ability to, of course, being a doctor and my wife being a nurse practitioner, we've always had the ability to treat injuries and had a good amount of medical supplies. But Hurricane Katrina, I think, is one of the big eye openers for us. We had been through Hurricane Andrew actually in the early 90s. I was actually part of the DMAT team there, and we saw the kind of devastation that can occur. And Hurricane Katrina in 2005 showed how even if a national emergency response is mounted, how unprepared we are to really deal with the number of injuries. I mean, as everybody thinks that we failed miserably as a medical response to Hurricane Katrina, but we actually activated the entire system pretty much before the hurricane itself hit the shore. So hundreds of these medical personnel were converging upon New Orleans and the area, and they were immediately overwhelmed by over 15,000 patient visits a day. So that lots of people, despite our best efforts at putting together a good medical response, they just weren't reached in time due to the fact that, the medical personnel just were overwhelmed, or in some cases couldn't reach the areas that were necessary to reach, to get to those injured people. So we also saw that there were no true medical professionals, actual medical doctors or nurse practitioners that were really willing to step up to the plate and talk about the hard realities that revolve around a true survival scenario. I mean, everybody that's a medical practitioner, their goal is to stabilize an injured or ill individual and transport them to the next highest medical resource, whether it's a hospital, a trauma unit, burn unit, things like that. But what if those things don't exist? Very few people are willing to talk about, or especially medical professionals are willing to talk about that possibility where the non-medical professional might well be the highest medical asset that a family has.
Sure. And Nurse Amy, lots of kids these days don't really know where their food comes from. You grew up in a more sustainable culture as a child. Can you tell us a little bit about that?
Yes. We were living in a little bit south of Atlanta. We had about 4 acres. And, it's funny, my folks, actually, both of my parents grew up in what I would say is a suburban area. So they, I guess, decided they wanted to be kind of like farmers. So we had homesteaders. We had quite a large garden. We grew, everything I can think of, from strawberries to okra to watermelon, tomatoes, beans, corn, pretty much you name it. When it was dinner time, my mom would say, okay, go get this, and then that's what we would eat. She even grew rhubarb and made strawberry rhubarb pies. Yep. And she canned everything that we didn't eat. So we would have food throughout the winter, which of course was not the growing season in Florida. We would go, Georgia. I'll get confused. I live half my life there and half my life here. But we would also go camping a lot, which just naturally taught you skills for survival without my father saying, hey, I'm going to teach you guys, how to live on your own if you had to, or if you get lost in the woods, this is what you do. We sort of learned it as we went. We cooked with Dutch ovens. We learned how to make fires without lighters and matches. And so we did a lot of those things just naturally. It was a lot of fun, and as I've gotten older, I've realized that was just so precious to know. There are children that grow up, they have no idea what the top of a carrot looks like, or how you grow corn, or where strawberries are from, or even how you harvest asparagus.
I didn't know that. You just taught me that. I'm looking at this fern-like stuff, and I'm like, well, maybe they got the seeds mixed up. But you just told me that it takes about 3 years, and then I've got to cut all that stuff down, and then I'll get asparagus.
Well, what you can actually do is, if your roots are old enough, and I did order my roots that were old enough, you can begin to harvest them, but it's really better to wait a couple of years to really let the roots take hold. And then the sprouts, the shoots that are coming up from the ground, they come up. If you let them grow, they can get 5 or 6 feet tall and turn into this beautiful fern, and like you said, they can make seeds. But what you're doing is you're actually cutting those off right at the ground when they're, pencil size or a little bit taller, and that's what you're eating. Asparagus spears are just the beginning of that fern in its very early growth, and you just don't let it grow that high. So you just keep cutting it off and cutting it off and cutting it off. Then when the winter comes, you're supposed to let it continue to grow and do its fern thing over the winter. At least here in Florida, that's how we do it. So yeah, you can go ahead and start harvesting your asparagus. You just only let it grow out of the ground a few inches.
All right, so I'm going to give it another shot on your recommendation. Dr. Bones, you had a recent article on your website, doomandbloom.net, about influenza. One part of the article spoke about immunity. I think we often think about getting sick and we think that it's completely out of our hands. And some of the factors influencing immunity are out of our hands, like our age, or if we work in an office or in close proximity to other people. But there's a few things that we can all do to boost our immunity. Can you name a few of the important things we can do to help us stay healthy now and after it hits the fan?
Well, immunity and what you just asked me, that last question you just asked me, are a couple of different things. Now, in order for you to stay healthy after the what hits the fan, first you got to get healthy before what hits the fan.
Sure.
You've got to maintain a normal weight for your height and age. You have to get rid of those bad habits. If you smoke, think about what the effect on your stamina would be, and imagine performing the activities of daily survival without 100% of your stamina. You have to deal with medical issues and also dental issues now, but while you have the technology, it might be able to help it. If you've got a bum knee, get it fixed now, because you're going to be putting a lot of strain on it in times of trouble. If you have a lot of dental issues, well, get them taken care of now. If you can save a tooth, save it now, because after what hits the fan, we're going to be extracting those teeth that give you trouble. And these are just some of the things. I mean, even what I did is I was very nearsighted, and so I actually went and had the LASIK procedure done, and now I've got the eyes of an eagle, a very old eagle, but but an eagle. So these are some of the things you need to do now. Additionally, you absolutely need to get your medical supplies now. You have to start stockpiling them now. Remember that you're going to wind up taking care of more people than you think you are. There are going to be people who you're just not going to be able to say no to when they arrive at your door. So get medical supplies, get more than what you need. If there's any extra, or if you think you have more than what you need, any medical item is going to be an extraordinarily valuable barter item in times of trouble. And additionally, one last thing, don't be a lone wolf. I think so many of our prepper friends are these rugged individualists, and they are ready to go alone. But you know what? You've got to stand watch. You've got to patrol the perimeter. You've got to grow food. You've got to prepare food. You've got to do so much that it's going to be a miserable existence if you're a sole individual trying to do this. Network with like-minded people. Get groups together. Put together a good mutual assistance group, and people with differing skills, and make up plan A, plan B, plan C, and work on that. Now, with regards to immunity, Amy's got a lot that she can tell you about, especially natural products that would help you with your immunity.
All right, so let's hear some of those tips.
That was a long answer. I'm sorry.
We got some long answers, honey. You need to shorten that up, bud.
No, that's great information. Don't tell him to shorten it up, Amy. That's great information. I love it. That's what I'm learning. That's one of the reasons I do the shows, because I learn so much. And it's just, I get to meet so many great people and get so much great information. So that's why I love doing it.
Yeah, we also do. That's what I enjoy doing interviews too. Talking about pre-disaster care, I also want to mention to make sure that you take care of yourself and you don't get sick now. In addition to your chronic conditions, like Dr. Bones talked about, dental and your eyes and your knees and your back and all these other problems we've got. Avoid, even just simple things like flus and colds. Make sure that you wash your hands frequently. And as far as foodborne illnesses or even water, make sure that the water you're drinking is safe and that you cook your foods thoroughly. Okay, those are some things you can do now. You can also take supplements. There's a lot of controversy about vitamins. But if you're not eating an adequate diet, these are some things that you might want to consider adding. Things like selenium, vitamin A, of course the B complexes. Vitamin C has always had the reputation of building immunity. There are some controversial studies about that, but I still do personally believe in vitamin C. We've got an epidemic in this country. I don't think a lot of people realize it, with low vitamin D levels. And I think this has happened for a few different reasons. First of all, we had the whole, the sun's going to give you cancer. The sun is going to give us all cancer. You better just stay indoors. And if you even think about going outside, wear a hat, thick sunglasses, cover yourself. Don't get in the sun at all. Well, we're finding that's actually not the truth, and that a little bit of sun, just everything in moderation, is actually really good for you. And if you can't get outside, maybe you've got a job that keeps you indoors all the time, and you go home and you've got to take care of your kids. You can't get outdoors then either, and you're busy in the weekends inside. You may want to consider a vitamin D supplement. It's not a bad idea. Vitamin E is known to help build our antibody responses, and zinc has also got a good reputation. So, some supplements may actually be worth having if you're going to try to build your immunity naturally through some foods. Garlic. I know there are people who take garlic every day. If you can get raw garlic, that would be awesome. There are also garlic capsules. I'm not sure if they're as good. Anything straight out of the ground and through nature, I believe is the best. So if you can get a hold of some garlic, that's awesome. Take a half of a clove and crush it up and take it with a spoonful of raw unprocessed honey. Now you've got two things that help keep you well. If anything is starting to happen, you may actually kill it because they're antibacterial. Ginseng is known to be wonderful to keep you healthy and build immune. There's also licorice root, and there's a lot of studies being done right now about the health of your gut and probiotics and the type of bacteria that live within your body, in your gut, that can help you fight off all kinds of things like cancer, like bacterial infections, like viral infections, and that our gut is much more important to our immunity and our health than people have ever realized before. So make sure that you're eating a healthy diet.
Very good advice. And lots of folks purchase prepper handbooks or they print out preparedness plans from the internet to help them get some guidelines on general preparedness. But many of the preparedness writers, myself included, don't have the medical expertise to provide in-depth knowledge of medical preparedness. You and Dr. Bones have a great book out that meets that need. Can you tell us a little bit about it?
Yeah, he went to school for 14 years and has been a doctor for, what are we up to now? Even 1,000 plus years of just experience. My education, I do have a master's degree in nursing. It's actually a dual degree. But yeah, I graduated from the bachelor's degree in 87. So what does that give me? 26 years now? So we do have a lot in our head, and we made that switch to say, okay, we're going to write a book. We're going to write it in plain English. We're going to translate that basic foreign language that we learned in school into something that people can understand. And we're going to tell them what to do, not and then go to the hospital and then call 911, but an absolutely, you are reading this book, you are using this book because nobody is coming to help you and you're in a dire situation. And we wanted to be able to give people a readable material that's not above their heads, no matter what you do in life, that you can understand this, and something that could help save lives. Honey, you want to add something?
Yeah, it amazed us that wilderness survival books and outdoor survival books, even books like Where There Is No Doctor, which is meant for third world medicine, actually almost always ended a chapter with, and get that person to the doctor, and get that person to the hospital. And so we wanted to write a book for situations where there is just no opportunity to do that. And so every single page of the second edition of our survival medicine handbook assumes there is no hospital, there is no doctor, that you, the non-medical professional, are the end of the line when it comes to the medical well-being of your family. And we teach that it's not in medicalese, it's all in plain English. And we talk about, 100 different topics, everything from injuries to
expiration date, antibiotics, burns,
even
lacerations,
right, even things,
wound care,
right, even things like sleep deprivation, anxiety, and depression, things like that. Right. You're going to be experiencing, if you're going to be the medic for your group, you're going to be dealing with anxiety and depression and issues like that much more often, I hope, than sanitation, and then you will gunfights at the OK Corral. So it's important. We wanted to really cover it from soup to nuts. We wanted everybody to know exactly. We also put out lists of exactly what medical supplies we think people need, for whatever individual situation that they're in, whether it's a personal individual kit or whether they are the community medic for a village. And we're just doing everything possible to make people understand that it can be done. That you can be medically self-reliant if you have to. Now, I'm not telling people to practice medicine without a license. That's illegal and punishable by law. But we want you to be ready, and we don't want you to have to be paralyzed if somebody gets injured in a disaster situation, such as, let's say, what happened to Hurricane Katrina, what is happening right now today with the typhoon in the Philippines.
And your book was #1 for survival medicine on Amazon. Is that correct?
Our book has been #1 in the categories of survival skills and safety and first aid since, I think, pretty much the whole time since. Well, this edition has been #1 since June 15th in both of those categories, except for 1 or 2 days. And the #1 book was also and in disaster relief as well. So this is a book that's been really well received. I can't tell you how blessed we are to have the kind words and support and confidence of the preparedness community. Really, not only in the U.S. but in really throughout the world. We have people contacting us with questions or with comments of support from all over the place, including the Philippines, as a matter of fact, since I was just mentioning that. So like I said, we have put together what I think is a unique book. It is a book that will give you information about chronic illness, about infections, about traumatic injury, wound care, all sorts of things.
And that's fantastic that your book's doing so well, and that just goes to show that it's just the best thing out there, because especially on these days on Amazon, everybody knows what they're getting because they can read the reviews, and that's just fantastic that you guys have put out such a wonderful product that can help so many people. And you just spoke about the typhoon in the Philippines, and that's just a really, really tragic incident that's occurred down there. How important is sanitation after a natural disaster like what we just saw in the Philippines? And what are a few things people can do to prepare to have better sanitation after those types of events?
You have to realize that as the survival medic, as a medically responsible person for your family or your mutual assistance group in times of trouble, you wear a lot of hats. You wear many hats, and one of those hats is that of chief sanitation officer. It is your responsibility to make sure that the conditions at your retreat, at your bug-in location, or your bug-out location, that those conditions will not cause infectious disease to run rampant among your people. And so you've got to plan out. I mean, you're not just there to treat cuts and colds and flus. You are there to supervise how you're going to deal with sewage, how you're going to put together a latrine, where it should be, at least 200 feet from your water source, how you'll sterilize water. That is one of the most important things. That's how almost everybody winds up getting some type of diarrheal disease if their water is suspect. You have to consider water filters or other methods of sterilizing water. You have to supervise how even things like how food is prepared, because improperly prepared food is a very, very, very common reason for people to get things like dysentery. And dysentery, as you probably know, killed more soldiers in the Civil War than did bullets or shrapnel. So these are just some of the things that you need to do. And you also have to educate all the people in your group as to what a clean technique is for not only food, but to deal with injuries, to dealing with sick people. You've got to put together a sick room, for example. Very few people have planned out exactly where their sick room is going to be in either their bug-in location or at their retreat or at their camp. And you have to realize that if you don't plan out which tent or which room of the house is going to be the sick room, that when somebody gets sick and you need it, you're probably going to wind up evicting somebody from that room or from that tent. And that's going to begin to sow the seeds of discord for a group. And so make sure that you plan out where that sick room is going to be, and make sure that it's not someplace that people are planning to be living in after the you-know-what hits the fan.
Very good advice. Nurse Amy, most preppers have Band-Aids, Neosporin, and probably some Advil in their medical kits in their bug-out bag. What are the top must-haves in a proper medical kit?
One of the first things I'm going to talk about is definitely personal protection. And that's not just your personal protection, but it's also personal protection for the sick person. And so we're talking about things like masks. Now, you have things are called surgical masks. Those are the cheap ones. Usually they have the ear loops or they tie behind your head. It's the common ones that you'll see in any of the medical shows that they put on. But that would really be best for the person who is coughing, because it's going to help hold those viral vapors that are being sneezed or coughed and thrown across the room straight into your face, the medic, who needs to stay very healthy. So it helps to contain that sneezing and coughing. So those are really important. Now the N95s, which are a little bit more expensive and gives you some filtration by, the air that you're breathing, you're going to keep from getting those viral droplets into your mouth. Those are what you're going to use for your medics. Okay, so you need to get both different kinds. Gloves, not just the non-sterile gloves, and I recommend getting nitrile gloves, N-I-T-R-I-L-E, nitrile. Those are non-latex. We've got a real problem in this country now with latex allergies. You don't know if the person you're about to touch has that problem. So if you just get the non-latex gloves, hypoallergenic, then you won't have to worry about hurting that person. Also get sterile gloves. If you're going to be performing, say, a dressing change on someone with especially a large open wound that you weren't able to close and it really did need to stay open, you should be donning sterile gloves. We're trying to keep out bacteria from the patient. Those sterile gloves are really not for your protection, because if you don't have cuts or scrapes or injuries to your hands, you can stick your hand into a vat of blood, and I don't care what it's got in it, it is not getting into your body. Our skin is our armor. It is here to protect us, and you don't have to worry about yourself getting an infection from someone else if you don't have an opening. It's the patient that you're worried about protecting. So we're talking about gloves, we're talking about masks. We also need to talk about tons and tons of gauze. I do have a highly exciting, and I'm joking when I'm saying that, video on youtube.com/DR Bones Podcast, and it's called Survival Medicine Gauze. And it's probably about 8 or 9 minutes, and it will explain to you why you use sterile, what is sterile, what's the non-sterile, all the different types of gauze that's out there, because it's something you need to know. You go through the gauze aisle and you say, my gosh, I'm overwhelmed, and you probably pick up one kind, and you don't realize that might not be appropriate for a patient that you're taking care of. So it is good to learn, and you can never, ever, ever have enough gauze. And I know Dr. Bones has said this before, and I've repeated this ad nauseum. Get tons and tons of gauze. If for some reason you feel like you have way too much gauze, you can always use it as bartering, because there's probably someone else who did not heed the warning to get that tons of gauze. Make sure you have lots of antiseptics. You're going to need things to clean wounds up. You're also going to need to get hand sanitizers. If you have an issue with water limitations, you can always use that hand sanitizer before you don your gloves instead of spending the 5 minutes scrubbing up your hands. So think of those things. Other things, definitely tapes. Many different kinds of tapes. There are people, again, who have allergies to certain kinds of tape. So get hypoallergenic tape. Make sure you get some paper tape. There's adhesive. Things like ace bandages and Copan, which is a wrap gauze. It looks like an ace bandage, but it's got a sticky side. Those are things that you can use on extremities to hold your gauze on to the patient's wound. And you can even reuse them if you have to. Splints are great. You want to think about if you're really going to go into it, you can get casting material. I know we've bought some casting kits that come with everything you need. We have some for arms and we have some for legs. When you're thinking about bleeding, you're going to want to get things like Celox or Quick Clot. We do recommend Celox because if you're taking blood thinners like heparin or Coumadin, those will work regardless. There are many different kinds of Celox. There's some that are powders to be injected in a syringe into a small, deep, narrow wound, and then there are the impregnated gauze, which are really great because you can put them into anything. They make them very large, 10 feet long. They also make them very thin, like 1 inch, in case you had someone who had a severe nosebleed. Don't forget dental. We have a lot of problems with dental. We have the wonderful medical dental facilities now, and you've got your dentist pretty much around every corner. But if there's a time that you don't have that dentist, your equipment might come in handy when somebody is really not feeling well from a dental issue. And if you let them go, they could get abscesses and infections, and these things can kill you. I mean, we really could talk on and on, but those are really so important. Of course, make sure you have some instruments and medications, and we have all of this listed in the book, and also online on our website, doomandbloom.net. You can find. I did one particular article that's called "Survival Medical Supplies," and you can print that out and start checking it off if you need. Also, the store that I have. Every single item that's in any of our kits is listed out in total detail. How many, what size, what it looks like, sometimes the brand names, if there's a brand name. And so you know exactly what I believe that you should have in your kit. And so you can use that as a nice checklist.
And the Israeli battle dressings, do they have a clotting agent already inside of them?
No, they don't. They are just a pad. It is a sterile pad. It is not impregnated with things that you're thinking of like Celox or Quick Clot. So it's a compression bandage. You're applying this, and then using it's almost like an ace wrap. It's a very, elastic type, attachment to this dressing, this very thick dressing, and you wrap this around the patient. And there is a plastic hinge that you're going to be putting this elastic material through, and you can pull it very, very tight. And so it gives you a really good compression. It is not as good as a tourniquet, but it gives you lots of pressure. If you're by yourself and you get injured and you're bleeding pretty badly, and this is all you have, it's your best shot. However, if you're bleeding pretty badly, I prefer you get that Celox in there, and then somebody, if not yourself, put tons and tons of pressure on it to help stop it.
Very good. Dr. Bones, do disaster scenarios put people at greater risk of injury? Maybe they're working with equipment they're not familiar with. Like, let's say, after a hurricane, maybe you're clearing your driveway from a fallen tree with a chainsaw. Are there more injuries in post-disaster scenarios?
Absolutely. I remember seeing a History Channel program that was called After Armageddon, and in it there was a family. Something happened, and you know what? And this family that was the father and head of the household was an EMT. Eventually wound up getting them into a community, a small community of survivors, and he cut himself chopping wood, doing basically an activity of routine activity for daily survival. Sure enough, he saw that the wound was getting infected, but sure enough, there were no antibiotics, or other medical supplies that would be able to help him. And so he died as a result, even though he knew exactly what he needed to actually get better. So we are going to have to expect, not only after a disaster, let's say a hurricane, with so many people receive traumatic injuries after Katrina, after Andrew, after this typhoon that just occurred, but just doing simple things that you're not used to doing every day. I mean, if you're not used to cooking over a campfire, you get burned. If you're not used to chopping wood, you can cut yourself or do some significant injury. People don't think about using hand protection or eye protection, so a lot of these people don't really have that in their survival medical supplies. And so we can expect many injuries to these types of just routine activities of just daily survival.
And Nurse Amy, I have a bottle of Advil that expires at the end of the month. Should I throw that away? And what about the prescription pain relievers I have in my medicine cabinet from my last dental surgery? I think they're expired as well.
Well, it's going to depend on how you store them. If you kept them in your hot car in South Florida and it reached about 120 degrees, it's going to degrade much faster. And this is what we have to understand about our medicines. They're not going to turn to poison. They're not going to kill you the day after their expiration date is over, but they're going to lose their effectiveness. And that's what's important to know. A medication that's stored at a much cooler temperature is going to last longer, and it's the same concept as your food storage. So low humidity, or as dry as possible, lower temperature, and dark. And these are the same principles. You will extend your shelf life of these medications by storing them in this manner. And like I said, they're not going to turn to poison. However, in 10 years after an expiration date of a certain medication, it might not be very effective. And maybe you're going to have to take 1 or 2 or 3 of these, whereas normally you would have had to take 1. You want to add something, honey?
Yeah, the expiration date is an artificial date that has been mandated by the government for pharmaceutical companies to guarantee that their medication is at 100% potency. Now, FEMA, as you can imagine, stockpiles billions of doses of various types of medications, antibiotics, and other types of medicines. But what happens is these medicines become expired. And so for many years, FEMA just run in the forklifts and threw billions of doses various medications, trash. But they sort of thought about it and they said, well, let's see what happens, what happens with some of these. We have to throw these away the day they expired. And so they put together an experiment called the Shelf Life Extension Program. And they tested about 100 different medicines that they had. And they found that almost all medicines that were pill or capsule form were 100% potent, anywhere from 2 to 12 years beyond their expiration date. And I suspect some of the ones that were 2 years beyond the expiration date were just, that they said were effective for 2 years, they might have been only 2 years expired at the time of the study. So I would recommend, as long as it is pill or capsule form, not to throw away these medications. Use your medications that are not expired in normal times, but you can certainly keep some of these medications in your medical storage. As a matter of fact, when the swine flu epidemic came around, I think in 2009, the government actually issued an emergency use authorization for the antiviral drug Tamiflu, actually extending its official approval for use for 5 years beyond the expiration date on the package.
And you mentioned the father in the After Armageddon show on Nat Geo or Discovery or whichever one it was you said, and he ended up dying from this infection, from this cut. If he would have taken fish antibiotics, would those likely have saved his life, or would he have grown gills and turned into a fish?
No, his scales might have become shinier and prettier, but But no, that will not happen. Yeah. I wrote the original article, about aquarium antibiotics. We're sort of an unusual combination. Not only are we medical professionals, but we also raise tilapia in ponds as a food fish. So when I would treat a person that had an infection, let's say let's pick amoxicillin as an antibiotic, which by the way would have saved the life of the father on the History Channel series. I would give them a human, so let's say 500 milligrams of amoxicillin. And when my fish got fin rot or some other bacterial infection, I would give them a medication that was known as fish mox. And I noticed that the stronger dose of the fish mox was also 500 milligrams. I noticed that there was only one ingredient in the fish mox. That was amoxicillin, 500 milligrams. I investigated fish mox in more detail. I found that it's only made in either the adult human dose or the pediatric human dose. There is no specific fish dose. And so I asked myself, why does my guppy need the adult human dose of amoxicillin to get better from an infection? And sure enough, when I opened up and I only did this once we had retired and we had gotten more involved with medical preparedness. I was looking for options for people because I was seeing a lot of unnecessary deaths that were going to occur from the simple infected cuts like what happened to the guy after Armageddon. So I opened up the human antibiotic, amoxicillin, 500 milligrams, and I found that it was a red and pink capsule with the numbers and letters WC731 on it. And I opened up the Fish Mox Forte, which was the stronger dose, the 500 milligram dose, and it was the red and pink capsule with the letters and numbers WC731 on it. And so, my logical conclusion is that it is the same drug made in a particular laboratory and it's doled out, some to human pharmacies, others to veterinary pharmacies. And since that time, I've had a number of people that have worked in the field, in the pharmacy field, actually confirmed that this is indeed what happened. We found about 10 or 12 antibiotics that meet my very strict criteria as to what is acceptable and what is.
Very interesting. Nurse Amy, if the worst happens and I run out of my stockpiled medical supplies, are there some home remedies or holistic options that I can use for survival medicine?
Yes, there are, Mark. And I'm sorry that I'm having trouble talking. I'm having a small asthma attack here.
Oh, I'm sorry.
It's okay. It's okay.
Luckily, you have a doctor.
I do, and I will tell everybody, I have had a cough for about 7 weeks on and off. I did go to the doctor on Tuesday. She sent me right over, had a chest x-ray, everything is fine.
All right, wait a minute. I've got the defibrillator here. Clear.
I'm good. There's nothing serious. She wants me to use some stupid, sorry, I say stupid, I hate taking medicine. I'm a nurse, we hate taking medicine. She wants to use a nasal spray, I don't know, steroid twice a day, and take Claritin. She even gave me a prescription for an inhaler system, so I don't know. We'll see. I'm trying to get through it. But anyway, things that would be great to have in your storage would be essential oils, and I have a pretty long list of them. And get to know essential oils. If you find that you want to start learning about them, just get one or two, learn about that, see if it works for you, try it out when you have some issues, and then move on. Don't go hog wild like I did. And I basically got probably 50 different essential oils. It's really hard to learn 50 new things all at once because natural medicine doesn't have just one indication. It's not like you're buying a decongestant and you say, okay, well, this is to open up your nose and let you breathe better. These things have many different uses, so it's hard to learn even about just one of them. And it is in our book of chapters. I also have lots of things online. Again, doomandbloom.net. You can find lots of stuff. I try to write about natural medicine. You can grow things that we think of as flavoring. Like we did talk about the garlic. And if you can raise bees, that would be awesome to have some raw processed honey. Cayenne pepper is fantastic. Again, ginseng. And then we start thinking about things like lemongrass. If you go to any Thai restaurant, most likely a lot of the food flavoring is lemongrass, but it's wonderful. Grow an elder tree. Grow some echinacea flowers if you can. Unfortunately, I will let everyone know in South Florida, don't even bother. I've tried probably about 50 different echinacea flowers in many different areas, and they are just not happy down here. Unfortunately, another really wonderful thing to grow, which grows in a lot of places we've visited recently, especially Washington State, lavender. Lavender is fantastic. So if you can grow some lavender, that's great. Now we can grow things like aloe vera down here, which is very lucky for us. But there's a whole list of amazing things that we think that are just spices, like rosemary and sage, thyme, and they really have medicinal benefits. So you gotta open up your mind, check it out, see if it works for you. And if it does, that's great. If not, move on, because there are many options out in nature to help us.
Very cool. And of course, we'll have links to purchase the Survival Medicine Handbook through Amazon, as well as a link to the Doom and Bloom website. But can you tell the folks who are listening on Stitcher or iTunes or YouTube where they can find you?
You can connect with us in all sorts of ways. Of course, you feel free to email us your medical questions at drbonespodcast@aol.com. Of course, you can follow us on Twitter. I hope you will. At Prepper Show is our Twitter handle. Our Facebook is Doom and Bloom and parenthesis TM for trademark. Doom and Bloom TM. And so you'll find us there. And also make sure you check out our videos on survival gardening and on medical preparedness and on YouTube at DR Bones Podcast Channel. So there are a lot of ways. Of course, you can get a copy of our book on Amazon or on our website at doomandbloom.net. And our podcast is on Blog Talk Radio.
Podcast.
That's right, is on Blog Talk Radio. So there are lots and lots of ways. Lots of ways to connect with us, and I hope I hope your listeners will, and I'm going to give you an inhalation treatment right after this, buddy.
Nurse Amy, we hope you get to feeling better. Dr. Bones, thank you so much for taking time to come on the show today. It was a real pleasure.
Thank you so much, Mark. We really appreciate it. We had fun.
Hey, Prepper Recon fans. I just published my new book, American Exit Strategy, Book 1 of the Economic Collapse Chronicles. Liberty-minded individuals who believe in the Constitution will find this near-future dystopian novel to be right up their alley. Those who are looking to be more informed about the potential threats to America's financial stability will learn what to watch for and how to prepare themselves for an economic collapse. American Exit Strategy is a work of fiction until it becomes history. Go to AmericanExitStrategy.com today to learn more or purchase your copy for Kindle in PDF format or paperback. Happy prepping.